My name's Asima. I'm one of the medical retina consultants. I work in the eye department, and my main job is to look after people who have diabetes and when the diabetes affects the eyes. If you have diabetes, then the circulation to your eyes is generally going to be not as good as somebody who doesn't have diabetes. The better the control you have of your diabetes, the better the circulation and the perfusion of the tissues of the eye. As I'm sure most people are aware, diabetes is when you have too much sugar in the blood, and the sugar affects the blood vessels. It damages the blood vessels, it damages the circulation, and that can happen everywhere in the body, and it also damages the circulation in the eyes. So your retina lines the inside of your eyes. It's like wallpaper on the inside of your eyes. And it has very fine blood vessels running within it, which supply it with nutrients and oxygen. Diabetes affects that, so the circulation to the retina is poor. It damages the blood vessels so that the blood vessels leak, so you get edema within the layers of the retina, or there is not enough blood and oxygen getting to the retina, so you end up with a situation where the retina is deprived of oxygen, and so you have the consequences of that. And all of that can lead to irreversible loss of vision. So we want to try and catch the effects of the diabetes on the eye before you get to the stage where you've lost your vision irreversibly.
I have an annual eye check where they take photographs of the back of my eye just to see if there's any retinal damage or anything else that might be going on. And I know that if they find anything, you know, if you have early treatment, you can get laser treatment to correct potential problems, that I'm not going to end up being blind.
The initial stages when the diabetes affects your eyes, you wouldn't have any symptoms. So initially you have diabetes obviously, but you may not have eye symptoms. And we want to catch the disease before you get the symptoms. So the eye screening is extremely important because we photograph these patients once a year, and we can pick up signs within the eye, whether that's signs of leakage or whether there's hemorrhages at the back of the eye, that tell us that this patient may in the future lose vision, and we want to catch them early and get them into the eye clinic so they can be monitored and treated if necessary.
Your health is everything, isn't it? I think potentially, and all these wonderful services are there for your benefit. You know, why miss them? I don't understand people who either can't be bothered or don't think it's worth it or think they can get away with it. It's just folly, in my opinion.
And I make sure that I attend because I do think it's very important to monitor my eyes for my future life. Yes.
Have you ever missed any eye screening appointments at all? For any reason?
No, not that I'm aware of.
Why is that?
Because it's important.
It's just something you have to do, isn't it? I'm quite an easygoing person, and if they say, I don't really question it. If they say it's necessary, then I'll go along and do it. And I just think it's a good thing. So for years I was going and having my eyes checked, and there was nothing to report. But eventually there was, and I'm pleased that I had it done and that they found it. Because your eyesight's valuable, isn't it? You can see the books I've got. I just love to read. I couldn't imagine not having my sight. I can't. I think that would be the worst thing for me if I lost my sight.
So it's important to say that most people who undergo the screening visit will have no problem with their eyes at all. The vast majority, it's a very small proportion of people that need to be referred in to see us. A lot of people will have some signs of diabetes at the back of their eyes. That's perfectly normal. If you've had diabetes for long enough, you're going to get some changes, but the vast majority of those don't need referral into us. So it's a very small number that will then come to us and be seen in the eye clinic. So the eye screening visits are extremely important because patients don't have symptoms and we want to catch them before they get the symptoms. So diabetic retinopathy is when the diabetes has started to affect the circulation of your eyes, and when you examine the eyes you can see signs of that. there are various stages of the retinopathy. There's the mild or background stage, where you may have a few hemorrhages, but it doesn't affect your vision, and we wouldn't necessarily need to see you for that. That can then progress onto the moderate retinopathy stage, where we start to see further changes which indicate that the perfusion of the retina is getting worse. And at that stage, you would be referred into the eye clinic for us to have a look, because we don't want you to progress onto the next stage, which is when you could end up losing vision irreversibly. That's when you start to get hemorrhages within the eye. You could also have swelling of the eye, swelling of the retina, which would impair your vision. And all of these things can be prevented and the progression slowed down by better diabetic control, not smoking, being on something for your cholesterol levels, reducing your weight, and all those sorts of things come together to help slow down or stop the progression.
Hello there, would you like to come through? Okay, would you like to take a seat there, Mrs. Watson? Okay, right. So the first thing we're going to do today is to get you to read the eye chart.
Okay.
Okay.
The screenings are conducted yearly as part of the diabetic patient's annual check. So before you have your drops in and you have your pupils dilated, you'll have a test of your vision. So there's a vision chart. They ask you to stand a certain distance away from the chart, and each eye individually, you start at the top and read your way down the chart. So as you go lower down the chart, the letters get smaller, and that indicates better vision. Patients would have their pupils dilated, so you have drops in. The drops take about 20 minutes to work, and they keep your pupils dilated for about 2 hours. So your vision is blurry for a couple of hours, so we ask people not to drive when they come for that visit. So you have the drops in and the pupils are dilated, and then they use a camera to take photographs of the back of your eye. They take 2 photographs of each eye, and those photographs are then stored on a computer and looked at usually within a couple of days, and they're given a grading. Depending on the grading, if there's anything of concern, that comes to a consultant, eye ophthalmologist to look at. And if those pictures are not of concern, so for example, if you have the mild retinopathy, then you will simply be sent a letter and asked to come back in a year. So depending on what the pictures show, you're either asked to come back in a year for another photograph, you may be asked to attend the eye clinic in 3 months to see a doctor, or you may be asked to attend the eye clinic to have an additional photograph taken. And that additional photograph is a scan of your retina, and that's called an OCT scan. It takes a scan through the layers of the retina, and it highlights any areas where there might be swelling of the retina. But if there is areas of swelling, then you'll be asked to come through and see a doctor to see if you need any treatment or whether you need monitoring.
Okay, so thanks for coming in, and we'll see you in 12 months' time.
Okay, thanks
Okay?
very much.
Thank you.
So there are other things that we can pick up at the screening visit. So if somebody has got blurred vision and it's due to a cataract, we will spot that on the photographs, and we will ask them to attend an eye appointment. Cataract is when the natural lens in your eye starts to go cloudy. So the natural lens in your eye should be nice and clear, and it should be colourless, and that can take on a whitish, opaque, or a yellow-greenish colour. And so that would mean that we might not get good pictures of your eye, or it might impair your vision, so we can do cataract surgery. Glaucoma is something where you have high pressure in the eye, which causes damage to the back of the eye, to the nerve of the eye. So if we see signs of damage to the nerve of the eye, then we may ask you to come in so we can check that. If you have diabetes, that is a risk factor for glaucoma. So on your annual screening visits, we could pick that up as well. And there's various other pathologies that can occur in the eye, such as a vein occlusion. If the vein of the eye is blocked and has caused a hemorrhage, we could pick that up. So that is not the primary reason to do the screening appointment, but it's a secondary thing that we can certainly pick up and ask you to attend the clinic for. So again, it just stresses the importance of attending the screening visit. And the screening visit picks up things that a visit to the optician doesn't do. So just because you go to your optician every year, it doesn't mean that that's okay. You don't need to come to your screening appointment. The screening appointment does far more, and you have clinicians, trained eye specialists that look at your pictures, which doesn't happen at your opticians. Number one, which everybody says to them, please try and get best control of your diabetes that you can, because once the changes kick in, it can be very hard to reverse them. And obviously we don't want people losing their vision from diabetes. And I think the second thing, if you can do that, then please attend your annual screening visits, because you know, if you miss those visits, then it could be 2 or 3 years before we see you again, and by that time again it could be irreversible. Number 3, I would say any concerns, our team is really approachable, and please just contact them, and you know, that whether that's by phone or through your diabetic doctor. We'd be more than happy to answer any concerns, anxieties.